Caris Hospice is a non-profit organization offering free palliative home care services to patients with cancer, irrespective of race and religion.
Hospice is not a word to be feared, but a word that brings service, comfort, understanding, and education to people with life-limiting illnesses. Our goal is to provide holistic care to patients and families in the home setting. On any given day, we, the hospice team, is ready to assist our patients and families through this life-changing event that they are experiencing. Hospice empowers the patient and families to have some semblance of control over death and dying. Many people prefer to die at home and out of the clinical setting of a hospital. They choose to be in their familiar surroundings, having the support of family around them, possibly even their pets, and familiar smells. We discuss with them and their families appropriate goals of care. We respect the patient's wishes and goals as much as possible as they decline with their life-limiting illnesses. We educate and help them prepare ahead of time the changes they may see or feel. This will help them alleviate some of the fears and stresses patients and families go through. Usually, families do all they can in caring for their loved ones. With some guide from us, they are able to make a difference, and they are able to do the very things they thought at one stage were impossible or frightening. We desire that the death of a patient be as spiritual, comfortable, peaceful, and dignified as possible.
As a hospice nurse, I perform the usual nursing duty, such as observing, assessing, and record symptoms. But I also work closely with doctor to control the patient pain and other symptoms that bothering and troubling the patient. Providing the emotional support is also an important part of my work. The medications and others intervention doesn't intended to cure a patient, but rather to make his or her remaining days as comfortable as possible. And I work as a team with the family guiding also and empowering them along. As a hospice nurse, my goal is to truly help my patients live until they die, to provide the compassionate care that promote the highest quality of life possible until the last breath is taken.
Every Monday morning, the nurse on call for the weekend will do a Passover report on the status of patients seen on the weekend to the rest of the nurses. The nurses will call the patients to follow up on their conditions or to make appointments to visit the patients in their homes and at the hospital. The call helps our nurses prepare the medication, equipment, or dressing aids needed by our patients at the home during the visits. Nurses leaving Caris Hospice with all the medication and equipment needed by the patients they are visiting for the day. They visit about 4 to 6 patients in a day. We are at the home of one of our patients, and you can see the nurse doing wound care. We also empower and train the patient's family to care for the patient. You can see Mrs. Chia is trained to change stoma bag for Mr. Chia. Prepare patients and their family to know what to expect and how to cope when the patient's condition deteriorates. Mrs. Chia will share with you her experience.
Caris Hospice doctor and nurses help my family and I to know what to expect and how to cope when my husband's condition changed. When my husband had a recurrence in the anus, After being well for 2 years of colon cancer, we contacted Dr. Wu and her team. They came to our aid immediately. They taught me how to take care of my husband and also gave me a referral letter should my husband's condition worsen and needed to be admitted into the hospital. He was admitted to have the colostomy surgery, then followed by radiotherapy. A few months later, he developed an abscess at the back near the anus, which recurred twice, and the last episode caused him to have high fever, shivering, and great pain. Dr. Wu gave a letter with details to see the surgical department in GH. After convincing him to go to the hospital, the surgeon admitted him immediately and the abscess drained. Thank God his wound healed in the month's time. My family and I would like to thank Dr. Wu and her team. May God bless them.
Next, you will see how the nurse access pain control and the use of medication to control pain.
Uncle, you 会痛，第时甲痛，啥物时阵是第痛？
bữa 12點幾一針，
半暝是啦。
半暝對。
哦，一痛的時你痛到醒起來啦，你困。
啊對，請起來，啊了報了。
แล้ว你食啥物？
食morphine。
食 morphine 啊。
2.5。
都2.5 ml 啊，你食 morphine。
2.5 ml。
你食了一落股10世痛。
About one hour 嘅嘅。
1 hour 嘅啊。But after that you able to still 嚇
？After that 伊個鋪裝啦。
會困啊，會困啊，困到天光啦。
OK。
哦。แล้ว早起時咧，伊痛過就轉來喎。
早起是鋪淡薄嘅。
Pulling like mouth pain. Pulling 啊。
Left hand side. Slightly, yeah.
But you can control very well with the gabapentin, Panadol.
Ada si peten macam.
Tahi peten.
Mau yêu kok.
Okay, now kau kini tu kau kini continue jalur yêu lah gabapentin ah, setahun 3 粒.
Okay.
一日3刀嘛，哈。
對。
แล้ว你 Panadol 2粒，一日3刀本咯，哈。你對條食，特別係 intermittent 伊 pain 來嘅時啊，severe pain 啊，你就啉 morphine，你2.5 ml 咯，是1到5 mg morphine。
Okay。
然後你就食，伊痛時你食。
大聽食啦。
嚇，大聽食，แล้ว佢有半點鐘。1點鐘啊，還是伊痛無少啊？如果係個係食到。morphine。
What you have seen is a snapshot of the many roles of a hospice nurse. At the end of the day, they still need to go back to the office to complete writing the report of each of the patient they have visited. As a hospice nurse, the work is not easy. They are out visiting patients irrespective of the weather, be it rain or shine. On weekends and public holidays, there will always be a nurse on call. Yes, we can truly say hospice does make a difference for patients who are facing a life-limiting illness and their families.